Welcome to Aging Gracefully on Suncoast FYI. Each week we talk to different experts and professionals on a wide range of subjects to give you tips and advice on living a happy and healthier life, no matter what age you may be. This week on Aging Gracefully, we talk to Alicia Couri, Dr. Russell Samson, and Dr. Sadiya Farooqui. Author Alicia Couri returns this week to talk about bad habits and how to avoid them. This is going to be a tough one. We all have those bad habits.
I know.
We don't necessarily want to talk about them, but we're going to do that today.
And some of them are not so bad, but some of them can age you prematurely. And that's what this whole segment is about, right?
Okay.
How to avoid things that prematurely age you.
So the reason you wrote this wonderful book is because of your own experiences.
It's definitely based on my own experiences. I'm not here preaching to anyone or telling them what they should or should not do. I'm just offering what I have done because people have asked me what I have done.
Because we want to look like you.
Right. So people have asked me what I've done, and what's in the book it's just been what I have chosen to do in my life.
Okay, so there's some habits that you've chosen not to participate in.
Yes, there
Okay.
are some habits.
How do you go about that?
Okay, well,
Where do you start?
for me, smoking was something that I never really enjoyed being around smoke, and so it's just something that I chose not to participate in. And while I was writing this book and doing the research on what are some of the causes, what are some of the damaging effects, I should say, on your age of smoking, I discovered that not only does it restrict blood flow and blood vessels, that will cause premature wrinkling, skin sagging, not to mention the damage to your internal organs, because it starts internally and it shows up externally.
Exactly.
So there are so many things that can happen. The wrinkles around your mouth become more pronounced. Your skin just becomes sallow. It damages your teeth, so you don't have a nice white smile. We talked about smiling earlier in a couple of the segments. And so, kind of those effects, I've been able to avoid some of those by not smoking throughout my life.
And I think, there's people out there that I know personally that have gradually weaned themselves. So it's not necessarily, if you've dealt with trying to quit smoking, it's not something that everybody can just cold turkey,
right.
But again, baby
steps. Baby steps. But you want to preserve the collagen in your skin, and that really definitely weakens that collagen in your skin. And as you age, sometimes it creates those dark circles and those heavy bags under your eyes, and that's all from smoking.
Okay, so those can be reversed. I know that if you stop smoking,
a lot of those things can go away, and especially if you start using things that help rebuild the collagen, that will help you too.
Okay, so one of the other taboos is alcohol.
Alcohol, I know. I get so many people like, no, don't take away my alcohol.
Don't say that.
I know, but it's something I've chosen not to participate in because I just didn't really like the taste, and I didn't like the effects, how it made me feel.
You're so fortunate.
I know, I just didn't really like it. So it's just nothing that I did throughout my life. And so the same thing with smoking. Alcohol restricts blood flow, so it reduces that collagen. It promotes sagging of the skin. It promotes loosening of the elasticity of the skin. It also, certain types of alcoholic beverages actually create rosacea in the skin, because those blood vessels, not only are they restricted, then they burst.
Do you know which ones those are?
Like whiskey.
Okay.
It's very bad.
All right.
And it can cause disfiguration. Sometimes people get that disfigured nose from over drinking. It's because of too much alcohol.
And it affects your liver,
again, the
kidneys,
internal organs get damaged that affects your age. When your internal organs don't work or function properly, it affects how it shows up on the outside as well.
So moderation. And as clean as you can drink.
And detox yourself every now and then. Choose to take a week off and just do a detox and cleanse and see how you feel.
It's amazing.
Yeah.
It is. I have done that.
But I'm not telling you to take it all away from you, because there
no.
are studies like wine. You know, some people drink red wine, and that helps with their heart. And so I'm not telling you. I'm just saying this is what I've chosen not to do.
Right. And again, there are some pure forms. Like, personally, I drink vodka. There are ones that have been distilled more than others. So you want to look for the cleanest types of alcohol and red wines. If there's sulfites in it, that's not good for you.
Right.
You know. So again, moderation.
Moderation.
And look at the labels. Right? Okay. How about prescription drugs?
So that's another thing
too, right?
that affects you as well. Again, internally and externally. It shows up externally. Narcotics, any kind of drug use, also it damages the collagen. It damages those blood vessels. It creates problems with your your dental. Not just the hygiene, but also, tooth decay and discolored teeth, and so there's a host of things that show up that prematurely age you. I mean, I've seen women, even men, who are in their 20s and they look like they're in their 60s or 70s because of prolific drug use. You know, because their skin gets sallow and gets saggy, and you want to avoid anything like that if you want to continue to look younger.
All right, solutions.
Well, we talked about detoxing.
Right.
Doing a gentle cleanse. There's so many cleanses out there. I will put up on my website a 72-hour cleanse that you can do in 3 days. 72 hours. That's
anybody
not
can
too
do
bad.
that.
Yeah, anybody
can
do a 72-hour cleanse just to make sure that you're detoxifying your body. And you want to hydrate. You want to hydrate as much as possible, so that you're putting back in what that's stripping out. And then we talked about rebuilding things that can help rebuild collagen in your skin. So you can go back to that tape and look and see the things that can help rebuild your collagen.
And again, everything's in your book, along with wonderful links.
There are links
give you more
to
information.
more videos and more information in the book.
All right.
Yay.
Thank you.
Don't beat me up.
No, we won't. We love you. Thanks, Alicia.
You're welcome.
Please stay tuned. Aging Gracefully on Suncoast FYI will return after a short break. Dr. Russell Samson joins us today to talk about unsightly hand veins. Welcome back, Doctor.
Thank you.
Okay, hand veins. We all have them. Some have larger veins than others. What causes them, and why? Why do we get them?
Well, most of what I've been talking about in these segments have been about diseases. This is not a disease. I'm sure people would hope that it's a disease, but it isn't. But your hands are usually in a dependent position your whole life. They're hanging by your side. And the weight of blood and gravity makes them start to get bigger and distend them. And over time, it's a natural progression that the veins on your hands are just going to start getting bigger and bigger. And they become unsightly. I mean, it's just a matter of time that they are. So men usually don't mind it. But I think women, when they get a little bit older, don't like the look of their
Right.
their
We just
veins
spell
on their
vein
hands.
differently.
Yeah, that's it correctly.
So what can we do with them? What are the treatments?
Well, it's not really a treatment, but it is something that we can get rid of them. So I use the word treatment for something that's an illness, but we can certainly make them look better. So what we've developed, and I think I'm one of the few people around in the world that does this at this stage, we make tiny incisions under local anesthetic in the office. So first of all, we put a little bit of local anesthetic into the fingers, and it sounds uncomfortable, but the local anesthetic travels up the vein. So all I have to do is put a little injection into the fingers round about the knuckles, and the local anesthetic travels up, and then I can inject above in the hand, and the top of the hand turns numb.
Okay.
And then using a tiny scalpel, it's the same type of scalpel that we use to make an incision in the eye. That's how tiny it is. You make a little tiny incision over the vein. And interestingly enough, the vein has got no pain fibers. So when I touch or grab or squeeze a vein, the vein doesn't feel a thing.
No, you don't feel it.
a thing.
No.
And so I can actually grab it with a specially designed hook, and through these tiny incisions, take the veins out.
Now, are they filled with blood? I'm just curious.
They're filled with blood.
Okay.
But you know, if you put your hand up like this, the blood empties right out. So we do it on a table. Basically, there's no blood in the hand when we take it out. Patient loses maybe a teaspoon of blood.
Okay.
So a lot of people say to me, well, what happens if you take the veins out of my hand? Won't my hand get swollen?
Right. Or will you lose feeling in your hand?
So well, if I do something wrong, you'll lose feeling. But fortunately, I haven't done that yet. But there are little nerves around there which I can inadvertently grab, and that would make a problem. But there's no real blood loss with this. And the incisions are so small, we don't even put in a stitch, just a little steri-strip. And actually, we control the bleeding by putting on a nice tight glove. So whoever has this done has to wear a glove for about a week. But they have full function. They can drive and take care of themselves. They just can't take it off to shower.
Okay. Now, so when it's done, are the veins completely gone? Your hand goes back to being a flat surface again?
So there are two good things that happen to the woman's hand. Usually I say woman because that's who it is, as from this procedure. Because as you age, you also start to lose tissue between the tendons. So the hand tends to lose like it's lost fat on the top of the hand. So that also makes it look older. So there is a little bit of swelling that happens after this operation that fills that out. So not only do you get rid of the veins, but you rejuvenate the look of the hand because it looks a little bit more swollen on the top. So it's not swollen, it just looks more healthy. So I know some people have used like fillers that you use on the face to inject into it, but that's pretty ugly and it doesn't, you have to do it frequently. This is a great procedure. And I have never seen a really swollen hand after this procedure because all the veins on the bottom are still there. We leave all of those behind. So a very nice cosmetic procedure, and it rejuvenates somebody because I think a lot of women who have had facelifts, they can come into my office and I say, well, you look much younger than your chronological years. And then I look at the hand and I immediately know how old they are. And you can take years off a woman's look by improving the cosmetics of the hand.
Now there's another procedure that you also do for hand veins. Can you tell me what that is?
Well, also for brown stains. As the hands start to age and they get these brown marks on them, we have light machines that can get rid of that. But generally, that's what it is. There are people that inject the hands with substances that kind of glue up the veins, but it can leave very bad brown marks. So and it can leave you with some discomfort too. This treatment that we have is pretty revolutionary because the veins don't come back. And you get a long-lasting, successful look.
Well, that's nice to know because, as we know, a lot of other procedures you have to have them done multiple times.
Multiple times, yeah.
But there was something else. So we mentioned briefly a stab avulsion.
Stab avulsion. Well, that's the term we use for the small incisions. Because if I told people they were going to have a stab avulsion, I think most of them would be revolted.
They wouldn't come in.
Come near us. So we have a much better term. We call it micro-incision surgery or microphlebectomy.
Okay, yes, that makes it sound...
Much better term, right.
Yes.
And it really works quite well. And it's not really, I don't think it's an expensive procedure. If you think a facelift can be $8,000, $10,000, $15,000,
yes, absolutely.
we charge $2,000 for a hand. And go back to normal activity right away with hands that make you look a lot younger.
Are there any potential problems?
You know, theoretically, you're not going to be able to use your hand for an intravenous because they're not going to have any hand veins, but you've still got all the arm veins behind. You know, potentially, theoretically, there can be swelling, but I've never really seen it. And as you mentioned, I can inadvertently nick a nerve because the nerves run right next to the veins, so that can cause numbness in the fingers. I did have one woman who temporarily had some numbness in the finger, but that disappeared. So far, other than maybe seeing the little scars, which usually disappear, I haven't seen much as a potential problem.
Now, because you've said this is basically cosmetic, does insurance cover this for any reason?
Not at all. Not at all. It's purely something for cosmetic purposes. Make yourself look younger. You don't need it.
Oh, aren't you
look so young
sweet.
as it is.
Well, I won't show you my hands. Thank you, doctors. Nice having you again.
Thank you.
We always like to end with your
this
website.
one was veinsandarteries.com or SarasotaVeinDoctor.com.
Okay. Thank you, doctor.
Thank you.
Thank you for tuning in to Aging Gracefully on Suncoast FYI. We'll return right after the break. We have a new guest in the studio today, Dr. Sadiya Farooqui from Elite Health. She joins us to discuss low back pain and the ways to alleviate the discomfort. Welcome to the show, Doctor.
Thank you so much for having me.
I'm so glad you're here. I have always had a problem with my back. So tell us about what are the issues that cause lower back pain?
Absolutely. So about 85% of Americans will face at least one episode of low back pain in their lifetime. That accounts for a significant amount of time and money spent in the healthcare system. It translates to about $89 billion. That's significant. It also translates to lots of time off that patients need for work because of low back pain. So there's lots of things we could do at home to try to help mitigate that and also to help prevent future episodes of low back pain.
Well, I just got so excited talking about lower back pain, but I'd like to start with, tell us a little bit about your practice, Elite Health, and a little bit about yourself.
Sure. So I'm with Elite Health. We're new to the area. We just opened our Venice location a few weeks ago. It's a Miami-based practice that really has a very proactive approach to healthcare and to cardiac prevention. We do lots of testing on site, including laboratory testing, X-rays, EKGs, echoes, stress tests. So we try to take the pain of having to go to multiple locations out for the patient.
And put it all in one location. Wonderful. And what is your specialty, doctor?
I did a residency in family medicine, and I have specialized in sports medicine.
Okay. And you're now located in Venice at that location, because there are two.
Yes.
But you're in the Venice location.
Exactly.
Okay. So back to back pain. Why do you think there's been such a significant increase in the occurrence of back pain?
Unfortunately, it has a lot to do with how we have evolved as humans. The back is composed of 24 vertebrae and if you look at the natural curvature of the back, it has natural curves. So it's an S shape, and you're supposed to be forward flexed, extended in certain areas. Now, as we have evolved, we have gone from leading very proactive lives to more sedentary lives. And now we're putting additional pressure on the vertebrae, we're putting more pressure on our hips and our pelvic system, and that has increased the significance of back pain and the incidence of it.
And a lot of that is computer, other things that we're doing?
Computer, TV, lack of, we're not hunter-gatherers anymore. So everything's coming to us. We don't have that same reason to use our body, unfortunately, that we were initially designed for.
So we know that those are some of the major causes. What are some of the things in our daily life that we could do to help ourselves to be proactive and not, if we don't have back pain, how can we prevent it? And if we do, how can we decrease it?
Sure. So some of the top things that we can do, and this actually applies to bettering yourself and your health in general. Stop smoking. When we're ingesting tobacco and smoking nicotine, you're actually decreasing the blood supply to different portions of your brain. Tobacco will significantly vasoconstrict, meaning you're not getting enough blood supply to your organs and extremities. Now, you can imagine that the little blood vessels that supply the spinal column are very tiny. So anything that will injure that is going to put additional stress on your back. Also, start exercising, walking. Swimming is good. It won't actually help with back pain necessarily, but at least keep you flexible and moving. Okay.
What are some of the other? I mean, that's something that we can do. But are there treatment options that you can do for your back?
Absolutely. So most incidents of back pain, acute episodes, will resolve on their own within 48 to 72 hours. And usually with a little help with anti-inflammatories or Tylenol, again, depending on what your chronic medical conditions are, a little rest, ice, heat, and anti-inflammatories will go a long way and hopefully get rid of some of that. If not, then I would suggest that you see your local physician.
Okay. All right. Heat or ice first? Is there?
So it actually depends. Most low back pain is secondary to a musculoskeletal type of injury, meaning that the paraspinal muscles that support the spinal column have been compromised. There could be an acute injury. So if it is more of an acute injury, you actually want to use ice to try to calm the inflammation down. After the first 48, 72 hours, I would suggest heat to help loosen the muscles up.
All right. So in addition to that, I know that you have a wonderful young gentleman who's going to show us some yoga moves?
I do. Javante McIntosh will be helping us demonstrate some things that we can do to help strengthen our core and also stretch our spinal column and back muscles out. So one of the major things we can do to help alleviate low back pain is actually to strengthen our core. So Javante will help us demonstrate how we can correctly do some core strengthening exercises. Here, he's going to hold a modified plank position for us. What that does is help build the muscles of the abdominal wall. When you do that, you take the pressure off of the low back muscles, and it'll help with posture as well. You want to start by holding that for about 10 to 15 seconds, and you can gradually increase it to 30, 45 seconds. So now we'll discuss some yoga positions that will help take away some of that back pain. This is called a child's pose position. It's very easy to do. All you want to do is get on your legs and cradle forward. What that does is help stretch out the muscles of the low back as well as the upper back. Next, if we can have the cat position. So again, we were discussing the curvature of the spine. What this does is help take away some of that pressure by putting your spine in the opposite position. Next, we have downward dog, which is also a fun position. And you may have to start by having your feet a little bit closer to your hands, and you can walk backwards and stretch that out.
Thank you for tuning in to Aging Gracefully on Suncoast FYI. To find previous episodes, go to snntv.com under programming. See you next Saturday and Sunday at noon.